Hello everybody and welcome. My name is Shafiq Ismail. I work at Pascolas, a national tech education non-profit with headquarters based in New York. Now, just a little bit about my background. Excuse me. I spent many years in the traditional mainframe world. Okay, I worked as a consultant across about a dozen states here in the US, specializing as a COBOL, CICS, JCL, and DB2 expert. Okay, um, if it ran on a mainframe enterprise server or computer, I was right there in the middle of it. Over the past 3 years, I have transitioned into the modern Windows ecosystem. Okay, earning my CompTIA A Plus certifications. Today, I'm proud to be an IT instructor at Pascolas, helping the next generation of technicians launch their careers in technology. So recently, I've been stepping into the massive world of healthcare, IT, as I dive deeper into how hospitals and labs and insurance providers communicate. I've realized just how massive and vital this ecosystem really is. So this video, and that brings us to today's topic. And today's topic, we're going to be talking about HL7. Okay, so let's bring up the slides. I have a few slides which I'm going to share with you, and I'd like you to have a look at that. Okay, so we're going to look at HL7, and you're probably wondering what HL7 is, right? So anyway, I'm going to try and explain everything in detail, and what we're going to do is we're going to try and do something a little out of the ordinary. We're going to build a little Python program. Okay, so hang on for that. Let me try and first explain what HL7 is. So HL7 is a universal data language which powers the healthcare interfaces and interoperabilities. Okay, so I want to share my research, okay, my studies, and a clear practical breakdown of how HL7 works, why we use it, and even how to parse it using Python. So sit back, relax, grab a cup of coffee, and let's dive right into it. Okay? Okay, so let's start at the very beginning. What actually happens when a doctor orders a lab test or updates a patient chart in a hospital? Let's look at this particular slide here. Okay, we're saying HL7 stands for Health Level 7. It it is a set of international standards and protocols that allow different healthcare computer systems to transfer clinical and administrative data back and forth. So think of it like a universal translator for medical software. Okay? So you may ask, why are we using HL7? Okay. So and now if we look at this particular slide here, it says, and you should realize that as far as the medical ecosystems are concerned, it's massive. Okay, so a sheer scale of data is overwhelming. A typical hospital processes thousands of events every single hour: admission details, lab results, medical orders, vital sign updates, radiology images, and manually rekeying even a fraction of this volume would require a massive army of data entry clerks working 24/7. All right. So therefore, and also on top of that, human error carries life or death risk. Okay, we're not playing around here. We're talking about people in hospitals. So there could be a life or death decisions and risks. So if we do it manually, okay, inherently comes with typos, missed digits or delayed entries. So in healthcare, mistyped dosage or delayed allergy flag or a misfiled blood test result can lead directly to medical errors, adverse drug reactions, or compromise patient safety. And then the other point is when a doctor orders an emergency lab test, waiting for someone to manually read the results in the lab and retype into the hospital's EHR, which is the electronic health record, it can create dangerous delays. All right. So HL7 automates this transfer instantly within seconds. So clinical and clinicians can make time-sensitive treatment decisions immediately. All right. So basically, it does plenty of advantages with the HL7. So let's look at what are the core benefits. Okay, the core benefits, and there's three basic ones. Okay, seamless or interface. Let's see if you can call it interoperabilities. Okay, it connects all those kind of systems, EHR, labs, billings, radiology, regardless of the software vendor. Remember, these vendors have their own software, right? So regardless of what software they use, okay, this HL7 is a universal language, and it will talk to any particular software package that they have out there. It acts as a universal language, so different applications can talk without custom integration for every pair. All right. It also, the benefits of it is the data accuracy and the patient safety. It eliminates the manual data entry errors, like you don't put in wrong numbers or addresses or any kind of details or lab orders. It ensures critical health histories, allergies, and also medications are updated in real time across systems. And this is very, very important, real time. Well, with all this, as far as the benefits are concerned, again, it dramatically reduces integration costs and implementation time for healthcare providers. It automates the routine workflows, freeing up clinical staff to focus on patient care. And that is our most important thing that we supposed to be worried about. But as an IT specialist, we can work on HL7, but can we do it manually? We may ask, is it feasible? Yes, we can. And we could do it manually in theory. Okay, but in practice, manual entry is too slow, too prone to dangerous mistakes, and far too expensive to keep up with the modern healthcare demands. Okay, notice the modern. All right, and in the US, things work a little differently from any other country in the world. Okay, so you might ask me, what kind of demands are there, and how much processing is really required? Okay, so I've got a few videos which I'm going to share with you, and they're short little videos, so listen in. All right.
Most people picture healthcare as a single building where everything happens under one roof. But in reality, it's a chaotic, fragmented web of independent clinics, labs, and insurance companies. So how does your medical history survive the jump between all these different businesses without a fatal error? A single routine surgery might start with a diagnosis at an outpatient clinic, your blood getting processed by a totally separate external lab, and the procedure itself happening at a hospital, all funded by a private payer. The only thing keeping these physical islands acting as one unit is a massive digital bridge. It pulls all those scattered interactions into a single live patient profile, a system called the Electronic Health Record, or EHR, and it actively guides care, instantly pushing a severe allergy warning to a nurse's tablet right before they actually administer the medication. But this hyper-connected system is fragile. If one admissions clerk gets locked out of their account, the entire hospital freezes. Care teams can't order labs, billing is completely halted, and physical surgeries are delayed until IT resolves the digital blockage. Healthcare IT isn't just fixing computers. It is the invisible life support system that keeps the entire medical ecosystem from collapsing.
Okay, so you've seen how important the life care system depends on the data. I did get it from the Notebook LM, and I'm just going to show you the next video.
You're prepped for surgery.
I beg your pardon. Yeah, let's do it again.
You're prepped for surgery. The team is scrubbed in, but they can't make a single cut because their physical work relies entirely on an invisible, high-stakes digital ecosystem. A modern hospital is never an isolated building. It's an interconnected web, constantly passing your data back and forth between independent labs, clinics, and insurance payers. To manage all these handoffs, every record routes through a central digital hub. This hub translates a doctor's input into immediate real-world action. It's called an electronic health record, or EHR. But this deep digital integration comes with a critical vulnerability. If just one connection fails, like a queue of lab results getting stuck, that error instantly cascades, locking down patient charts across every single department. Which brings us back to your delayed morning surgery. The operation can only begin when IT restores that digital bridge, proving that in modern healthcare, data flow is just as vital as blood flow.
All right, so you've heard that. So data flow is just as important as blood flow. And as an IT technician working in the healthcare industry, it's very important to take note of these delays and, of course, for any kind of errors, okay? Because it's very prone for errors if you do anything manually. All right, so let's see what kind of data, who are we, or what information are we sending data for, and what kind of interfaces we have. All right, and that should be on the next slide, which it has got a video, and this is about a 6-minute video, so relax, continue sipping that coffee of yours.
A new patient arrives for surgery at MedAllies Health. The pre-op team is scrubbed in, the operating room is prepped, and the surgeon is ready to begin. But at the front desk, the process stops. The admissions clerk encounters a critical login failure, locking them out of the electronic health record system. Without access, the clerk cannot register the arrival. The patient's digital chart remains unopened and inaccessible to the rest of the facility. This creates an immediate obstacle for the clinical team, who are unable to order the laboratory clearances required before the first incision can be made. In the pharmacy, the impact is just as severe. Pharmacists cannot verify the patient's weight or known allergies, preventing them from dispensing the necessary surgical medications. The delay reaches the administrative wing as well. Without a registered encounter, the system cannot generate the billing codes required to secure coverage from the patient's insurance provider. Because one digital entry point is blocked, every specialized department in the hospital is forced into a holding pattern. While healthcare was once viewed as a collection of independent buildings, modern medicine functions as a highly interdependent data network. The IT support analyst manages the technical infrastructure that allows these clinical connections to function. In a networked environment, a software failure is a clinical bottleneck. This makes technical support a primary factor in maintaining patient safety. To resolve the crisis at MedAllies, we have to map the larger healthcare ecosystem and see exactly where the data flow has been severed. The network begins with providers. This includes hospitals for acute inpatient care and clinics for long-term outpatient management. When a patient moves from a clinic to a hospital for surgery, their survival often depends on the clinical history stored in their previous records. Laboratories form another critical node.
These facilities rely on electronic orders to process and return diagnostic results. If results are delayed or misfiled due to a system error, the medical team loses the data they need to confirm a patient is stable for treatment. The ecosystem also includes payers, the public and private insurers responsible for reimbursing healthcare services. For the hospital to remain operational, a constant stream of clinical and financial data must reach these payers for processing. Regulators oversee the entire network, setting and enforcing the standards for care quality and data privacy. Finally, third-party vendors supply the specialized software, hardware, and medical devices that the other entities use to communicate. Because these different groups often use proprietary software and unique internal processes, there is constant technical friction between them. Standardized data exchange is the only way these distinct organizations can coordinate a single patient's care safely. The ecosystem is built on these interdependencies. Any broken link in the data chain reduces the capability of the entire network. To fix the link, we have to look past the organizations and focus on the specific digital systems that bridge the gaps between them. The electronic health record, or EHR, serves as the central hub of this digital architecture. It centralizes clinical notes and orders while providing decision support, such as automated warnings for medication allergies. The workflow begins with patient registration, which generates the active digital chart required for any other system to interact with that patient's record. Once that record is active, the provider can input specific clinical orders for the surgical team to follow. These orders move to satellite systems like the LIS, the Laboratory Information System, which manages all blood work and pathology data. When the EHR sends an order to the LIS, the lab processes the test and routes the resulting clearances back to the surgeon's view. For imaging, the network uses PACS, Picture Archiving and Communication Systems. PACS is designed to store and transmit high-resolution files, like X-rays and MRIs, ensuring they are attached correctly to the main EHR chart. Simultaneously, the pharmacy receives verified orders through the EHR, matching medications against the patient's recorded weight and history. In a successful loop, specialized data from the LIS, PACS, and pharmacy all converge within the central patient chart. Because this information moves through a sequence of connected systems, the lockout at MedAllies stalled every downstream process in the surgical pipeline. At MedAllies, the surgical team cannot proceed until that data flow is restored. The IT support analyst arrives to diagnose the specific point of failure within the network. They must first determine if the problem is a localized permission error for one user or a systemic crash in the interface queue that moves messages between systems. Every single step of this technical intervention must strictly adhere to HIPAA regulations in order to protect patient privacy. The analyst works to restore access quickly, ensuring that protected health information is never exposed to unauthorized personnel during the troubleshooting process. Recovery begins with a controlled restart of the halted services, which must be done carefully to prevent the corruption of active clinical databases. The analyst then examines the interface queues to locate and release any clinical messages that were trapped in transit during the system downtime. During the verification phase, they confirm that no patient data was lost, overwritten, or duplicated while the system was unresponsive. If a lab result was delayed, the analyst manually verifies that it correctly populates the specific patient's chart once the connection is restored. Resolving the technical lockout restores the clinical workflow, directly returning the hospital to a state of operational safety. Once the analyst clears the access block, the data backlog flushes through the system and the digital chart opens. Surgical clearances appear for the medical team, and the procedure begins exactly as planned. This resolution is made possible by the 4 core pillars of healthcare IT. These pillars define how technology supports the ecosystem. Data storage and data sharing provide the foundation, keeping medical history accessible across providers. Decision support and privacy protection serve as guardrails, reducing errors while securing sensitive data. By managing the flow and security of this information, the IT analyst ensures clinicians have the exact data needed to make informed, life-saving decisions.
All right, so you could see what the anatomy of a system failure could cause an institution or a hospital, what the impact would be. All right, it's very, very big. I mean, it can affect many different players and stakeholders within the hospital. The providers, for example, or the laboratories that rely on that information, the payers, the regulators. Okay, so all the information is stored on one database, and that is the EHR, which is the electronic health record. And all the labs are kept on a different database called the LIS, which is the laboratory information system. And all your x-rays and labs and all your PACs, what they call PACs, which are the picture archiving systems, and they're all digital. Okay, all that is kept on a different operating system or different system database called PACs. So remember, all this information has to end up in the EHR. So the doctor working with the patient, the nurses working with the patient, has to be able to see all the results and then make a very, very intelligent decision on what to do next. Okay, so if anything, if there's a break anywhere, okay, everything halts. Okay, so it's very important that we have seamless HL7 transactions running through each and every transaction that actually takes place. So this brings me to my next slide, which is the anatomy of an HL7 message. So let's have a look at what that is about. All right. Okay, so before we actually get to that, just want to show you how many different entities are involved. We have the providers, the payers, the technology, the EHR database, the LIS database, the PACS database, and all these, okay, all depend on the data. Remember, we also need to cater for HIPAA in the US, all right, which is very important, all right. And then everything that we're really talking about evolves around the patient. So you can see that this ecosystem really depends on the patient. The providers, the vendors, the regulators, the payers, the laboratories, everything. So the patient's the center of attraction, if you can call it that. All right. So these are the different scenarios and all the links that goes on between all the different systems, okay? All the different interfaces. So if something happens anywhere down the line here, you're not going to get the information, all right? The information is going to be halted, and someone like ourselves as an IT specialist needs to investigate and find out what is causing the problem. All right, because the billing doesn't get done. Adjudication will never get done without the billing going through. Okay, so if there are messages out there which we need to clear out, or maybe restart the system, okay, that needs to be done to be able to justify or rather restart the applications again, then that's what we need to do. But you've got to get a good idea of what's involved in it. You just can't willy-nilly go and change or stop anything, because the whole process will be stopped. All right. So let's concentrate on what the anatomy of an HL7 message. Okay, that looks daunting, right? Okay, we really do not know what's happening here. All right, so we're going to try and break that down. Okay, so let's inspect this. At first glance, it looks like it's a block of random text and pipes and carrots, and but actually it is very structured. Okay, so let's have a look at the first three characters. That is the segments. All right, so if we look at this, we're looking at, these are messages or segments, and we're looking at MSH, and MSH tells us who send the message and who receives it and the timestamp. Then we have the PID. Okay, the PID is all to do with the patient. Okay, the patient's demographic details like name, ID numbers, and so on. The PV1 is the patient's visit. Every time a patient visits, there needs to be an entry. The ORC or OBR, which are orders and observations, details the specific test required. For example, a complete blood count, which is a CBC, or an OBX, which is an observation result. It contains the actual clinical test results, and that's also a HL7 transaction. All right. So let's try and figure this down. Let's have a look at further messenger types. Okay, so if we're looking at the MSH, which we've done, the PID is the patient, PV1 is the visit, ORC is the order, that's an observation request, and that's an observation result. Okay. The workflow, the doctor actually does some kind of diagnosis, and he sends that to the lab then sends it for results, and it eventually ends up in the health record, okay, database. All right, so that is the workflow. Everything ends up in the EHR, which is the electronic health record. There are a few more messages of interest. Okay, the ADT, which tells it with the admission, all right, and discharge, and also all the transfers, with all the ADT messages. ORM, this is an order for a lab test, all right. The ORU is an observation result, returning the lab result, okay, and then you get the SIU, which is the scheduling information, and lastly the DFT, which is a detailed financial transaction for billing, and this is the one that will actually get adjudicated further down the line. All right, now now there's too much to talk about, so what we're going to do is we're going to have a look at one particular record, and that's the PID. All right, so for the fun stuff, let's begin here. Okay, we just know that it's faster, it's accurate, it's automated, and it has better patient care. It uses a popular HL7 Python package to parse, and all we're going to be doing now, we're going to do a live demo parsing an HL7 in Python. Okay, so we're going to take the raw HL7 message and extract the key patient's details in under 15 lines of code, and I'll show you how that is done. And this is my the whole reason for this video. Okay, so what you need to do on your Windows machine, you go to your terminal and I'll give you a step-by-step, instructions of what you need to do. You go to your terminal window and you type that in, pip install HL7, and that is the command that actually installs that package. Okay, after it's done that, you then want to go into Windows Explorer and create a file. Remember, it must end with the .py, because that would be a Python type script that we're going to be writing. Okay, so create a new file on your Windows desktop. Okay, put it out into the desktop so you can find it easily, and call it parse_hl7.py. okay, once you have that file, it's going to be empty. Okay, then the next step would be you need to copy the Python code from GitHub. If you look in the description of this video, there's a link provided, and you can actually pick up the actual code, which is 15 lines. But what I've done, just to illustrate what the code looks like, I'm going to give it to you right here. The first thing is we're going to take the code starting right in the beginning. We're going to take a raw HL7 data, okay, which looks like this. A whole lot of pipes and carrots and a whole lot of things. But if we look at this here, now if we're going to look at our next statement down there, we are populating a variable, okay, with this data into MSG. Alright, so MSG is picking up all this information. If you're not too technical, don't worry about too much, but just try and follow the logic behind it, okay? So what we're doing is we're taking all this information and we're putting it into a variable called MSG, which we're going to be using later. And then once we get the PID, so what this says is look in the first 3 columns of that message. Remember I told you that data was in that variable MSG? Look for the first 3 characters. Okay, how does it know it's the first 3 characters? It's because of that 0 right there, okay? Because Python works like tables, it actually starts from 0 and then goes on to the next one until it finds another pipe and so on and so forth. And it moves consecutively and it goes in ascending sequence. So the next one will be a 1 and a 2 and a 3 and so on, every time it finds a pipe. So let's see if we show you that. You see, this is the first occurrence of that table. So we're looking for the first 3 characters. So this is our first pipe. So this becomes 0. Okay, PID. I'm not going to teach you how to write programs in Python, but I'm going to give you a good idea as to what to look out for. Alright? So if this is PID, which is the first pipe, alright, so we're only going to concentrate on the PID message right now, alright. So let's go ahead. So we're looking at PID. Now we got to extract the patient ID, and the patient ID, as we're telling it, is in the 3rd segment. So do you see PID segment? Remember, in that whole segment we're looking for the 3rd one, the 3rd pipe. So let's go back. Alright, look at PID. This is 0. There's a pipe. This becomes 1. There's a pipe. In between here, that becomes 2. There's another pipe. That becomes 3. So we're telling it, pick up the 3rd possible information right here, which is 1, 2, 3, 4, 5, 6, 7, 8. And what does it need to do with that? It needs to put that into something called patient ID. So that's how we extract the patient ID. Okay? I don't want to complicate things with the components right here, but I'm going to get to one a little bit later, just now, when we get to the first name. Okay? So let's go on to the patient name now. So let's go back one more time. If you look at the PID, we know that that is the patient ID, but where is the patient's name? Right here, right? Though, that is a caret, which is generally a space of some sort, a John, and then an A would be the initial. So where is that in the sequence of which number we need to put in to be able to pick that up? So if we said, okay, do it with me, guys. If that is 0, this is 1, in between here it's 2, this is 3, all the way until it gets to the next pipe. That is 4, in between, and that would be 5. Do you agree? So do. And if we look at that caret, that actually separates it. Okay, so let's look at what we're doing here. We're telling it, pick that up, okay, from the fifth segment, okay, and pick up the first piece of data in the component. Those are called components, okay, which is down here. All right, the components are down there. So we're telling it pick up the first component, which is 0 again. It always starts from 0. But let's look at first name, for example, which is also in the fifth segment. Okay, do you agree with that? Which is also in the fifth segment. However, do you see those carrots? We're telling it, do not pick up the 0, do not pick up the 1, but we want the 2, which is the actual, we want this guy, John, his first name, okay? And what we're going to do here is, do you see this? Which is 5, and because it starts with 0, we want the 1, which is the second. Okay, let me go up and explain that again one more time. Alright, it gets a little confusing, but let's do it again. If this is 0, then that becomes 1. Alright, next component. This is the component, alright, and if you look at the actual segment, we're telling it segment 5, component 1. Okay? And component 1 is John. Alright? Component 0 is Doe. So component 1 is John. So what are we going to do with John? We are going to put that into a variable called first name. Okay? So now we have the patient ID, we have the last name, we have the first name. Let's go and extract the date of birth. Okay, now that you know how to do that, it should be fairly easy. So let's go and have a look as to why we're using segment 7. So let's go and have a look. Alright, just look at the PID. That's all we're concentrating on. This is 0. That's a 1. That's a 2. That's a 3 all the way. That's a 4. That's 5. That's 6. And boom! Do you see that? That's segment 7. Alright? And there's a pipe there. So we're looking at segment 7, and we know that this is the date of birth. Okay? And remember, this is a universal language, so wherever you go, this is the structure, and this is how every system in the US knows about HL7. If they're going to be using HL7, this is going to be the same structure as you go along. Alright, so we now pick up 7, and it's only got one component in it, right? It doesn't have carrots. So we're picking up the 0, that's all. If there's going to be more than one component in it, that's why you have all the other brackets right there. This one here in the middle says repeat, but I'm not going to go into that now. We're looking at segment 7. Alright. Then our next statement says print patient ID, which we've already got. Remember, we got the patient ID. What does print mean? Just display it. Display it on the screen. Display the full name on the screen. The first name and last name right next to it. And then print the date, the birth date. Alright, because we've picked up all the information. What we had to do is extract it from the PID segment. Alright? So let's go ahead. I've just put it out here what I did is I put it into Notepad, so you can also do it in Notepad, but what you need to do is run it, okay, and I'll show you how I've run it. I've put it in terminal, and because it's executable, all I did was I just ran past HL7. And how do you do that? You use the /, okay, to run that particular, if you're going to be using Linux, and if you're going to be using just the terminal, then all you need to do is just double click this and it should start off. Okay, and if you run that, because it's got a PY, it knows that it has a script. And boom, just like that, we've converted it to readable text that looks just like this. That's beautiful, right? So now you know how HL7 works, okay? You know how to extract the information, and it's very, very important that you keep note of one thing, and I want to tell you what that one thing is, okay? And that is, if you look at the actual code, do you see there's a /R right there? It's very important that you have an R to say that that's a continuation. If you do not say that, okay, it's not going to work. So keep that in mind. Make sure if you have an N there which says next line, which you really do not want, you want a /R, okay? That caught me up, and I had to try and work it out, and that made this particular example and this program and the script work for me. All right, so keep that in mind. Okay, so let's go ahead. You saw how that's done, and how many lines do we use? I mean, we used about 15 lines at the most, right? That's the whole script basically. All right, plus setting this up, the raw code. You need that, okay? Read this line over here and that line, the message line. So we're looking at probably 15-16 lines at the most. All right, and voila, you have your report. All right, so as far as tips and reminders are concerned, remember the /R carriage return needs to be there, okay? You need to pick up the code easily from the link provided in the description section of the code, which is of the actual video, all right? And to recap, HL7 is the standard language healthcare software uses to share patient data, all right? And its messages use segments, okay? And those are the segments, and it uses pipes for different types of fields and carrots for subcomponents, all right? We know how that works, right? We've done that, okay? There is another version which is a web-friendly standard version, which is a newer HL7 version, which is called FHIR, and you pronounce it as fire, okay? That's how it's been pronounced, okay? Which is a standard for mobile and cloud applications. We're not going to delve into that right now, maybe another video in the future, but all we're going to be looking at is version 2. This is version 2 that we're using, all right? So remember, if you're really looking for something in the future on fire, then please let me know, send a comment and tell me that I should go ahead and do another one just for fire, and I could do that quite easily. All right, guys, if you found this tutorial helpful, okay, please smash that like button, okay? And of course, subscribe for more in healthcare, IT, and coding content, and drop any questions and comments below. Thank you for watching. Talk to you later. All the very best.